Most people think if a medication is common, it must be safe. If millions of people take it, if pharmacies stock it on every shelf, if doctors prescribe it without hesitation, it must be harmless. I used to think that too, until I started counting how many hip fractures I saw in patients who were on medications their doctors called routine. A 72-year-old retired teacher, sharp as ever, still reading 3 books a week, active in her garden every morning, taking 4 medications her doctor said were completely standard for someone her age. Blood pressure, sleep, pain, allergies. Nothing unusual. Nothing to worry about. She got up to use the bathroom at 2 in the morning, same as she'd done 10,000 times before. She doesn't remember the fall. What she remembers is waking up on the floor in the dark, unable to move her right leg, the pain so severe she couldn't call for help. The fracture required surgery. The surgery led to complications, a blood clot, an infection, 6 weeks in rehabilitation. The complications changed everything. She never went back to her garden. Here's what nobody told her about those 4 harmless pills sitting in her bathroom cabinet. What I'm going to tell you today. My name is Dr. Michael Hartwell. I'm a cardiothoracic surgeon with 28 years in the operating room. I've opened over 2,000 chests in my career. I've held beating hearts in my hands, and I've spent nearly 3 decades watching the same preventable patterns repeat. Patients who did everything their doctors told them to do, took every pill exactly as prescribed, and still ended up on my table or in the emergency department after a catastrophic fall. The medications weren't the only factor, but they were the factor nobody thought to mention. Today, I'm going to tell you what nobody took the time to explain to them. Your body after 60 is fundamentally different from the body you had at 40. This isn't generic aging talk. This is specific biology. After 60, your kidneys filter medications more slowly. Your liver metabolizes drugs less efficiently. Your muscle mass drops, which means there's less tissue to absorb medication and more drugs circulating in your bloodstream. Think of it like this. At 40, your body is a full crew working 3 shifts. At 70, it's a skeleton crew working overtime. The same dose that was safe at 50 can become dangerously high at 70, not because the pill changed, but because your body's ability to process it changed. More than 50% of adults over 65 are taking at least 5 prescription medications simultaneously, and 3 out of 4 falls in seniors involve at least one medication that affects balance, blood pressure, or cognitive clarity. The margin for error gets smaller every year, and smaller margins mean bigger consequences. Now, this first medication surprises people every time I bring it up. Blood pressure pills. Not all of them, but specifically a class called alpha blockers. Names like doxazocin, terazosin, prazosin. Your doctor might have started you on one of these years ago to help with mild hypertension or prostate issues. They work by relaxing the muscles in your blood vessels and prostate. The problem is what happens when you stand up. After 60, your body's ability to quickly adjust blood pressure when you go from sitting to standing weakens. It's called orthostatic regulation. The younger body compensates instantly. The older body takes longer. Now add an alpha blocker into that equation. You stand up from your chair or get out of bed at night, and your blood pressure can drop 20, 30, even 40 points in seconds. You feel lightheaded and dots. The room tilts. You reach for something to steady yourself, but your reaction time at 70 is not what it was at 50. One missed grab and you're on the floor. I had a patient, a 70-year-old man who'd been on doxazocin for 12 years. He got up to answer the phone one afternoon. He woke up in the hospital with a subdural hematoma. Have you ever checked your blood pressure immediately after standing up? Most people never have. Write that down. The next time you see your doctor, ask them to check your blood pressure both sitting and standing. If there's a drop of more than 20 points, that alpha blocker might be doing more harm than good. The fix here isn't complicated. There are other blood pressure medications that don't carry the same orthostatic risk. Your doctor can switch you to an ACE inhibitor or a calcium channel blocker. Same blood pressure control, far less fall risk. That conversation is worth having. Let me ask you something before we go further. How many times in the last month have you felt a little foggy, a little unclear, especially in the evenings? If the answer is more than 0, this next one is critical. Benzodiazepines. Nandidi and dendasamans. These are medications like lorazepam, diazepam, alprazolam, temazepam. Your doctor might have prescribed one for anxiety or sleep, and they work. They calm the nervous system. They help you fall asleep, but they also do something else. They linger. In a younger body, these drugs are metabolized and cleared within hours. In a body over 65, they can stay active for 24 hours or longer, which means if you take a sleep medication at 10p, you're still feeling its effects at 10 a.m. the next day. You don't feel drunk. You feel fine, but your reaction time is slower. Your balance is slightly off. Your spatial awareness is just a fraction delayed, and a fraction is all it takes. 3 times higher fall risk. That's not my opinion. That's published data from multiple large-scale studies. The risk doesn't come from the fall itself at first. It comes from the fact that you don't realize you're impaired. You walk down the stairs the same way you always have, but your foot placement is slightly off, your hand doesn't grip the railing quite as firmly, and suddenly you're tumbling. I can already hear the skepticism, and honestly, good. Healthy skepticism is what keeps us from falling for nonsense. So let me show you exactly why this works the way it does. Benzodiazepines bind to receptors in your brain that control muscle relaxation and cognitive processing. The older you get, the more sensitive those receptors become, and the longer the drug stays bound. It's not that the medication is bad. It's that the body it's entering is more vulnerable. Does any of this sound familiar? You're not alone. If you've been on a benzodiazepine for more than 6 months, talk to your doctor about a taper plan, not cold turkey. Never stop these abruptly, but a slow, supervised reduction over weeks or months. There are non-benzodiazepine alternatives for sleep, like low-dose trazodone or melatonin, that don't carry the same fall risk. Starting tonight, write down every medication you take, and when you take it, bring that list to your next appointment. That simple act might save your life. 2 more medications after this one. And medication 4, that's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. Here's where it gets complicated. Pain medications, specifically opioids. Medications like oxycodone, hydrocodone, tramadol, codeine. If you've had surgery, a serious injury, or chronic pain conditions like arthritis, you've probably been prescribed one of these at some point. And I'm not here to tell you that pain doesn't deserve treatment. It does. But here's what happens inside your body when you're over 60 and taking an opioid. First, they cause sedation, not just sleepiness, but true central nervous system depression. Your reflexes slow, your coordination weakens. Second, they cause constipation, which leads to straining, which leads to sudden blood pressure changes, which leads to dizziness. Third, and this is the part most people don't know, opioids affect your inner ear. Your vestibular system, the part of your body that keeps you balanced when you walk or turn your head, becomes less responsive. You might not feel dizzy. You might feel completely normal. But when you step off a curb or reach for something on a high shelf, your body's automatic correction system is delayed by milliseconds. And milliseconds matter. I treated a 68-year-old woman 2 years ago. She'd been on tramadol for knee pain for 8 months. She tripped on her own front step, a step she'd walked over thousands of times. Fractured wrist, fractured hip. The hip required surgery. She developed a post-surgical infection. She spent 6 weeks in rehab. All of that from a medication her rheumatologist said was one of the safer opioids. Which of these medications do you recognize in your own medicine cabinet right now? Tell me in the comments. I read every single one. The question to ask your doctor, write this down exactly. Is there a non-opioid option that could manage my pain with less fall risk? Ansins desenfine en she. There almost always is. Physical therapy, topical NSAIDs, acetaminophen, steroid injections. None of them are perfect, but the fall risk is dramatically lower. This one is the hardest to talk about because it affects cognition and nobody wants to believe their mind is vulnerable. Anticholinergics. These are medications that block a neurotransmitter called acetylcholine. You might not recognize the drug class name, but you'd recognize the names. Diphenhydramine, the active ingredient in Benadryl and most over-the-counter sleep aids. Oxybutynin for overactive bladder. Certain antidepressants like amitriptyline. Certain medications for nausea, for dizziness, for allergies. These drugs are everywhere. And in a younger body, they're mostly harmless. After 60, they're a different story. Acetylcholine is critical for memory, attention, and muscle control. When you block it, especially chronically, you get what's called anticholinergic burden. You get dry mouth, blurred vision, confusion, difficulty concentrating. You also get something more dangerous: muscle weakness and impaired coordination. Your legs feel slightly heavy. Your hands don't quite do what you tell them to do as quickly as they used to. You chalk it up to getting older. But it's not age. It's the medication. And here's what nobody tells you. The effects are cumulative. If you're taking 2 or 3 anticholinergic medications at the same time, even at low doses, the burden compounds. One study showed that seniors taking 3 or more anticholinergic drugs had a 50% higher fall risk compared to those taking none. 50%. That's not a rounding error. That's a coin flip between walking safely and ending up in the emergency room. I need you to hear this clearly because this is where the most preventable damage happens. You don't need to be on these medications forever. For sleep, there are better options like melatonin or CBT for insomnia. For overactive bladder, pelvic floor therapy works for many people. For allergies, newer antihistamines like cetirizine or loratadine have far less anticholinergic effect. The fix here costs nothing. Ask your pharmacist, not just your doctor, to review every medication you're taking and flag anything with anticholinergic properties. Pharmacists are trained in this. Most people never ask them. I want to be honest with you for a moment. Not as a content creator. As a surgeon, I have stood at an operating table at 3 in the morning holding a heart that stopped beating because of complications from a fall that never should have happened. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 8 hours earlier. In case after case, the contributing factors were not mysterious. They were blood pressure pills, sleep aids, pain medications, and allergy treatments. These are not exotic risk factors. They are the background noise of millions of ordinary evenings. And that background noise, accumulated night after night, year after year, increases fall risk by margins nobody bothered to explain. I want to tell you about a patient. I'll call her Margaret, 74, a retired librarian, still volunteering at the local literacy program twice a week. She came to me after a fall in her kitchen resulted in a broken collarbone and 3 cracked ribs. When we reviewed her medication list, she was on an alpha blocker for blood pressure, a benzodiazepine for sleep, tramadol for back pain, and diphenhydramine for seasonal allergies. 4 medications, all of them considered safe by conventional standards, all of them contributing to her fall. We worked with her primary care doctor to make changes, switched the alpha blocker to an ACE inhibitor, tapered off the benzodiazepine over 8 weeks, and replaced it with melatonin and a sleep hygiene protocol. Replaced tramadol with scheduled acetaminophen and physical therapy. Switched diphenhydramine to loratadine. 6 months later, she told me she felt clearer than she had in years. Reduced from 4 high-risk medications to 0. The first thing she said to me was, "Why didn't anyone tell me this sooner? Ansansi, Decini." That question stays with me. It's a big part of why I make videos like this one. Let me recap those 4 medications. Number 1, alpha blockers for blood pressure or prostate issues. They drop your blood pressure too fast when you stand, especially at night. Number 2, benzodiazepines for anxiety or sleep. They linger in your system for 24 hours or more and slow your reflexes without you realizing it. Number 3, opioids for pain. They sedate you, affect your balance system, and create dangerous delays in your body's automatic corrections. Number 4, anticholinergics found in sleep aids, bladder medications, and older antidepressants. They impair muscle control and cognition in ways that compound when you're on multiple drugs. Which of these 4 do you recognize in your own routine? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who needs exactly this information. Send it to them. That one share might be the most important thing you do today. Every week, I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your heart has been working for you every single minute of every single day for 70 years without ever asking for anything in return. Give it this. Take care of your heart.